Hi guys, it's Grace with Grace Gets Gastric, and I'm here today for my 1 week post-op plastics update. So, if you're new here, hi, my name is Grace. I'm 5'8", 28 years old, and on January 2nd, 2018, I had the vertical sleeve gastrectomy or VSG weight loss surgery. My highest weight ever recorded was 354 pounds, and I lost 35 pounds over a 6-month medically supervised weight loss diet. So my starting weight day of surgery was 319 pounds. Lost a bunch of weight. My maintenance range, my weight basically the day of my plastic surgery was 192, and my plastic surgery was on January 29th, 2020 with Dr. Alejandro Galvez in Tijuana, Mexico. I had a full abdominal lift or corsetplasty. I had a breast lift, and I had a bra line back lift with 2-zone lipo on my back. So it has been 1 week since my surgery. In fact, as of filming this 1 week ago, right now, I was in my hospital room kind of waking up. So a little bit crazy. If you can tell from the stuff behind me, we are actually leaving tomorrow to go back home. We've been here since surgery in this lovely hotel, but I am flying back home tomorrow, which I am planning to vlog just to really talk about the whole experiencia. But yeah, this is hopefully going to be a shorter video than my other ones because it's just a quick 1 week, and I've been trying to vlog as much as possible, which hopefully you've been seeing. Sorry if I adjust. Trying to find a comfortable spot is not always easy, but what do I want to talk about? So today is, because it's also my 1 week, but it's also the last day here, had some things to do, specifically my 1 week post-op appointment with Galvez. It's not even a 1 week post-op. It's you meet with him and his partner Sanchez, Dr. Sanchez, before you go home, because they just want to really make sure everything's looking good. So that went great. You know, they checked all of my incisions. One of the things they really stressed before surgery, when Galvez was doing the markup, was he was talking about nipple necrosis and basically losing the nipple, and like really kind of freaking everyone out because he gave the whole same spiel to everyone else, which is part of why in the end he would not have done implants once he realized how much he would have had to, he was lifting, just because that increases the risk of that happening. And in fact, one of the women here last night unfortunately had to go to the hospital and have one of her implants removed because her nipple was just not doing well, and there was a risk of losing the nipple, so they had to remove one of the implants. But luckily that is not happening to me and should not happen. He said everything looks like it's healing really well. I never, starting immediately post-op, had any kind of like bleeding around that incision site or anything like that. So, you know, he was really pleased with how those are looking, was saying that he, you know, feels like I'm probably in the clear there in terms of necrosis. Checked my, you know, he was happy with how they had turned out in terms of fullness and symmetry, which I was happy with too. So far as I've noticed, if I hunched over looking in the mirror, it seemed like, you know, they were fairly even. So, you know, he was happy with that. Checked over my incisions and said everything looked good, everything was healing well. I did ask him about lipo. He didn't tell me how much he ended up taking. I don't think he knows, or I don't think he remembers, but he did it kind of on my upper back along my sides right here, I think, just to smooth things out right around where he was taking it out. And then I think he did some for my lower back, because where he went in on my upper back was on the flap that he ended up removing. But where he went on my lower back, I think he went in actually through my tailbone, which might also be part of why I have such tailbone pain, because I saw something on my tailbone and it looked like a scab and I couldn't figure out what it was, and there's a stitch there. So it's actually from the lipo hole, he's like stitched it closed. So that was, I was like, what is on my tailbone? But so there's that. But, you know, I got to ask him questions. So I had, you know, asked him a bunch of questions, things like driving and all of this stuff. You should be asking your surgeon when you have surgery, because it is going to vary based on what you had and etc. So they said for what I had and for me, Like for driving, they would say 4 weeks is probably what I want to do. Working out is 3 months. Maybe some like light cardio, low impact, very casual at 8 weeks, but definitely no kind of weights until 12 or 3 months. I also asked them, about like wound care and all of that stuff, and I ended up picking up a couple of more things from when I sent the valets out to one of the valets to get some Muprosin, which is an antibacterial gel or cream, and some of the silver gel, which is supposed to be good for like if you have wounds for healing them. So I got some of that here because it's cheaper and easier to find. So I have that in case of emergency. They give you a list of aftercare instructions. So I'm a little unclear and I still need to clarify. It says basically a list of the medications I'm taking, and it says 7 days. And so I think that means 7 days from surgery, in that which case I should be done with the medication. But it could mean 7 days once you leave. So I need to ask them if I'm taking medication and for how long, which I'm gonna see the doctor. So I'm gonna ask her, and I'm going to be emailing them pictures of everything every week to make sure so that they can keep an eye on how everything is healing. And then if I have any other questions at all, I can email, there's a special email for aftercare, so I can email them for that. Sorry, I'm a little bit gassy. What else? Oh yeah, he said, Dr. Sanchez was looking at my results or something, and he said that I could have the right drain on my breast removed before I left, which would be nice because then I would only have 4 drains instead of 5, and I could see a doctor do it and all that stuff. But then, because they were gonna have Dr. Soria do it, who is the doctor who's been checking on us every night, and she said that I was still draining too much from there, just a little bit too much, but still too much. And so apparently, and I didn't get to speak with her, so this is all like through people, that she might remove it tomorrow. So I'm guessing she won't, and I'm going home with all 5 drains, which is fine. I really only wanted to have one out. I want them all out because they're annoying, but I really only wanted one out so that I could see like a medical professional do it, just to be extra sure I know what I'm doing when I do it. But I know that I'm going to be draining more on the plane, so I don't mind having them in, and better out than in, as they all say. I did ask too about stitching. So most of the stitches are dissolvable except for the stitches around the drain sites and I think the lipo site and then the belly button. So those will have to be removed manually, but otherwise the stitches will dissolve on their own. So the other thing I did today, I think that's pretty much everything from that appointment. It was great. They've got such great bedside manner, and honestly, they're just awesome. Cannot recommend them enough. But the other thing I did today was writing out thank you cards for, and organizing tipping for the nurses and valet and staff care here. So we've been tipping housekeeping every day as they come in, but we also, and this is completely optional as tips generally are, but it is generally considered best practices to tip the nurses that are here, not the ones in the hospital, but the ones that are at the hotel, as well as like the valets. So there's 2 of them here who will like run all of your errands for you and get you all the things like I just talked about. And I also tipped, then you also want to tip the physical therapists that come in to do the massages. And then I also tipped Mama Galvez, who provides your meals twice a day. So it's totally up to you how much you want to tip and all of that stuff. And if you even want to tip at all, some people do, some people don't. Everyone does it differently, but I did bring extra cash specifically for tipping. And I ended up tipping, I would say about $300 total, around there. So that is something to potentially keep in mind. If you don't want to, you don't have to, but I would, because they're really going above and beyond for literally, you know, checking on you at all hours of the night. They work crazy hours here to really just bend over backwards. One of the valets, her boyfriend, drove to California, drove up to the States to get to an Amazon Dropbox to pick up something that one of the patients here had shipped and needed right away. Like, just unbelievable. So I would recommend tipping, but again, you know, how much you want to tip and how you want to do all of that, it's up to you. But I did bring thank you cards so that I could write little notes and then put the money in for them, because you don't necessarily see everyone. Some people you can tip each time if you want, but again, like, it's totally up to you. I'm just going to do it all at the end. But I will say, I ended up not bringing enough thank you cards because I thought that there would only be a handful of nurses that were here, and I ended up having, like, I don't know, how many am I tipping? 1, 2, 3, 4, 5, 6, 7, 8, like 9 nurses that I'm tipping. And then there were a couple of other nurses that I literally just saw once to check my vitals, probably 4 more that, and I'm not tipping them just because I don't, you know, like, they weren't doing quite as much as the others for me personally. And also I ran out of cards, but luckily another one of the women here had extras, so I now have literally just enough, which is perfect. But yeah, that, I was just gonna say, the tipping thing is something you might want to consider, just keeping in mind when you are budgeting out for this. If you're coming down here, that is generally consider something that you should be doing. But I think that's pretty much everything. Maybe I'll throw up, I'll go over here. I'll throw up a couple of like before and afters. They're the ones that I've had on my Instagram. One might not have been posted yet, so they're nothing new yet, partially because I just have not yet been able to take ones. It's hard to do it because you have to do it when you're out of your faja, and you're only ever out of your faja when you're in the shower. And when you're before and after your shower, like, the nurses are here because they're helping shower you, and so it's really awkward to be like, can we pause and then let me put on like a bra and underwear, and then let's take some photos, and then let's finish. You know, it's like a whole thing that's a little awkward. So I think when I get home, it'll be a little bit easier for me to do that. So I will plan on having some more photos at my 2-week post-op, and we'll see. The other thing is that the tape around my incisions is still there, and he said it'll probably last until around 3 weeks post-op and then start to fall off. And once it falls off, you know, he just let it do what it wants. But it's hard to really, I think, see the incisions because there's tape on them. And I'm still hunched over, so I do think that the hunching and the swelling, man, the swelling is real. I'm really curious to see what I weigh when I get home. So I'll probably weigh Friday morning, because that'll be my first morning waking up at my place, and you don't weigh in the middle of the day or like a savage. So that will be the first time weighing myself since the morning I left for my surgery. So it will have been basically a week and a half, more than that, who knows. It would have been a week and 3/4. So curious to see. I'm certain that I'm swelling, but he also removed 15 pounds of skin, so, and a little bit more in lipo. So who knows what that'll look like. Anyways, I think I'm going to go now. We've heard that the churros here are excellent, and so I'm going to have some. So I'm gonna finish this video, finish writing out these thank you notes and doing some of the packing, and then I think I'm going to go downstairs and have some churros. So thank you guys, as always, for watching. I hope you have enjoyed this video and all of my videos. Thank you for being here. Thank you for joining me. Go ahead and do all those fun things like and subscribe and comment down below. Let me know what you think and if you have any questions. And otherwise, I will talk to you in my next video.